Hi, it's Dr. Bette Robin with the Dentistry Rising podcast. I'm really happy to say that we're surpassing all of our goals in number of podcast downloads. And that means it seems I'm on the right track as to what you need help with and what you want to know. I do talk to many of you every day since I am a dentist as well as an attorney, and I really get what your issues are. My goal is to help you get where you want to go in the best possible way and to create the practices and lives you are proud of and want. So today, I'm going to talk about being successful in your practice and in your life. And I think there are ways to help you achieve that success more predictably. Nowadays, it's popular to talk about morning routines. I mean, there's an abundance of information on what successful people do during their first hour after they wake. And I think that information is really valuable. And the most important part to note is that almost all of them do something. Doing something is better than doing nothing. I've been doing a morning routine for many years, but I call them gather rounds. That's because my dogs join me. They particularly like to meditate since dogs are inherently good at napping. But whatever you call it, I do believe it's extremely important to have an organized way to start your day. I've been doing this since my first practice and before it was popular, or at least before it was talked about. I think we all need to know where we are going with our day and what we want to accomplish. I've added some things to my gather round and subtracted things as the years have gone by and I found them relevant. I'm going to go over with you what I do now, so hopefully it helps you come up with a plan for yourself. I start with meditation. I only do 10 minutes, but that's what I can do and stay consistent. I know supposedly 20 minutes is better, but when I try to do 20, I quit. So 10 it is for me. I use Kevin Rose's app Oak often, primarily because it's free. But I also love Deepak Chopra with Oprah. Maybe that's kind of a girl thing, but it's great. Of course, there are a lot of other good apps like Headspace and Calm. I also only meditate once a day, and again, I know twice is supposed to be better, but I do what I can do and stay consistent. Then I do what I call a brain dump. What's in my brain I want out, and like any negative thoughts or unproductive focus, and then what needs to be inserted in my brain. Just a quick check. Sometimes I write lists. Sometimes I draw a picture of my head with arrows coming in or out. Whatever I feel like. I just do it so I can be clear about what I'm focusing on and what I want to focus on. Like Dan Sullivan from Strategic Coach says, I try to think about my thinking. Next, I write my gratitudes. I think gratitudes are really, really important to get your thinking off correctly for the day. I write them in a journal, and I don't have any rules about them, like it has to be a new gratitude every day. In fact, my dogs make the list pretty much every week. It can be a small thing, like how delicious my coffee is, or it can be something huge, like my parents, my education, and the opportunities I've had. I just think it helps me focus for the day. Then I do a ta-da-ya, which I adapted from Gretchen Rubin, who wrote The Happiness Project. I think briefly back to yesterday, that's the ya part, and consider what made my day worthwhile, with hopes of repeating the worthwhile parts on other future days. For me, and I think for many of you, it's just so easy to plow ahead and not think of yesterday. It isn't always an accomplishment I did, because I am very goal-oriented, and I don't usually have problems in that regard. But I really want to think about what made me happy yesterday and what made my day worthwhile. Lately, I've added a happiness check, or actually 2 of them, since I want to make sure I'm happy every day and doing what I want to do. If I don't think about it, sometimes I plow ahead without ever really thinking about something and seeing if I really do want to do it. So in the morning in my journal, I rank my happiness between 1 and 10. I try not to use the 7 since it's kind of a cop-out number. I'm usually an 8 or 8 plus and like to stay there most of the time. And I've added a new happiness check after listening to Jim Collins on a podcast. So what I do is rank myself at night and I'm using the scale Jim uses right now, -2, -1, 0, +1, +2. Although I sort of want to change it to 1 through 10, but I haven't yet. So the additional thing he does is to enter his number into an Excel spreadsheet and then list out in columns the things he did that day to make the number whatever it is. I mean, really simple things. That way he can go back and sort for the +2 days and see what they consisted of. I'm usually at a +1, and I've only had a couple +2 days since I started recording myself on my Excel spreadsheet. And they were both when I've had long, fabulous conversations with friends over dinner. I obviously need to do more of that. But whatever it is for you, I think it's important to be happy in life and to figure out what makes you happy. Lastly, I picked 3 things I'm going to accomplish that day, and I set the intentions for those 3 things as to how they'll go. I try to pick things that will take my business forward and have the most impact. For example, if I have a listing appointment for a practice that seems to be really great, I pre-think the appointment and set an intention to focus on it and get the listing signed. For me, writing things on a daily list almost mandates to my brain that I accomplish them. I don't know why, it just does. You have to do what works for you. So I start every day with my list and go methodically down it and get it done. I even make a time schedule for how long things should take. I mean, I'm a dentist at heart, and I schedule things like I did my patients. So I gave you an idea what I do, so hopefully I can spark ideas from you as to what you might do that would help you. Here are some things I thought might work for you. Number 1, I will totally engage with my new patient who is coming in at 11 a.m. I will be totally present with him or her, and then help them understand the treatment they need and schedule that treatment. Number 2, I will stay off my phone in the operatory and talk to patients so I can really get to know them and then truly understand their needs and wants. Number 3, I will appropriately engage with my staff and demonstrate professionalism to them. Just some thoughts. I hope I've given you some ideas you might be able to implement to get wherever it is you want to do, wherever you want to go. If I did, please subscribe to my new podcast, Dentistry Rising, on iTunes or Stitcher, and let me know what you're thinking. Thank you, and I'll talk to you soon.